Well, I'm Sister Dorothy Kaur Swee Leng. Originally, I'm from Penang. I am now 81 years old. All this time, when I have been in the convent, I have worked very much with women in pregnancy crisis, young girls in pregnancy crisis, and also teenagers with problems. I still continue with my ministry to the capacity that I'm able to. It started in August, actually, 2022, when I was in Singapore, when I suddenly realized there was a big lump in the middle between my left breast and my armpit. So after the 2 days after that was the end of my retreats, I went to see a doctor. And the doctor then referred me to do an ultrasound in a hospital in Singapore. The result came back strongly not malignant. No need to worry at all. I was advised to take a course of antibiotics. I was told that if you take the antibiotics within 2 days, the swelling will go down. After I came back to Ipoh, the swelling had not gone down. So I went to see my doctor. And the doctor said the same thing. I'll give you a course of antibiotics. If it doesn't go down, then you come back to see me. It didn't go down at all. I went back to see him. So he did a needle biopsy. The needle biopsy result was shocking. It showed that it was strongly suspicious malignancy. The surgeon said, I'll operate. I immediately told my niece in Singapore, she's also a doctor, and she said, no way you should do any surgery. What you would need to do now is to have a PET CT scan done. And I got the PET CT scan done in Sunway. I was referred to the chief hematologist there, Dr. Chang Kian Ming. He painstakingly explained that I have diffuse large B-cell lymphoma, aggressive stage 4.
She had this large mass in the left armpit that was infiltrating into her left chest wall. And when we did a PET CT scan, she had a stage 4 disease, which was pretty aggressive and pretty dismal.
That's the end. Because when I heard stage 4, and at my advanced age, all the more I felt it's the end. So Dr. Chang said, we would like to offer you something. The hospital has been allotted one place in a clinical research study.
So taking part in clinical trials helps us to design better treatments, treatments which are potentially safer, more effective. And also because I think we are now an aging society, we need to have better treatments for older individuals that they can tolerate. So, and this can only be made possible if we take part in clinical trials, and that was the option open to her at that time.
I trust Dr. Chang knows what he's saying and why he is recommending this to me.
Firstly, I really want to thank her. She was very keen and she was very enthusiastic. Clinical trials, are not easy to take part in because, for the safety of the individual, they need to come back regularly, once a week, twice a week, or even more frequent if necessary. In actual fact, trials are all heavily regulated. It goes through many processes, not through the sponsors only, to drug regulatory agencies, to medical research ethical approval, worldwide, before they are even launched. So subjects don't have to worry too much about this.
Anyway, I went ahead with it. I thought it was very gung-ho. The cycle 1 was all right. So by the time of the second cycle, I think my body was feeling
Yeah, I think for anyone who is undergoing cancer treatment, it is not easy. There are a lot of side effects, from cancer treatment. And that is the whole purpose of taking part in trials, because we need to understand the effects of medicines better. We need to discover better medicines that has less side effects, all right?
I felt very weak, too tired to want even to get up, and totally lost my appetite. Dr. Chang and his team, they were very, very patient and closely monitored my condition.
The good thing about trials is that they are designed to protect the individuals, and the trials are designed in such a way that they are very systematic. Whatever potential side effects that you have, what to do with the medications, how to modify the treatments, So in a nutshell, it not only provides an experience for this patient, it also gives an experience to the investigators like us, because it improves our treatment processes.
The support of my family, the assurance of prayers from all the Good Shepherd sisters throughout the world, my church friends and friends from elsewhere, their support boosted my wanting, to fight this listlessness and this tiredness. And then Dr. Hon Xiong Ling, especially, I want to give her credit because she truly energized me, and she was such an inspiration for me.
Her last chemotherapy was in January 2023. Today is 18th of December 2024, so she's almost 2 years out of the treatment. So these are very good signs, because if you remain in remission for 2 years or more, the likelihood of achieving a cure, it gets higher and higher the longer that we do. And we will continue to monitor her, and hopefully, if she's cured, she can live to whichever age that, she deserves to.
To me, it's a miracle I am where I am today, with the help of God and the help of the doctors.
Maybe people are ignorant of the fact that clinical trials are important and that clinical trials are available. So when they come to their hospitals, they should ask whether there are clinical trials that are available, so that we all contribute to the knowledge of the society and for the benefit of all.
If and when you get an opportunity, you're offered a clinical trial drug, go for it. To the medical team in Sunway, I want to say to Dr. Chang Kian-Ming, Dr. Hong Xiong-Ling, and the other doctors they're younger doctors in training, I think, who have been to and fro coming to help. I would like to say thank you.
So I really wish her a pleasant journey, good luck, and I'm sure she's cured from her disease.